wear mask, wash your hands frequently, and get vaccinated on time. Never ever forget about social distancing. Hello everyone, this is Arun here, welcoming you all for the second series of the Facebook Live-In program from All India Institute of Speech and Hearing, Mysore. It's a union government institute under the Ministry of Health and Family Welfare, working tirelessly for the people with communication disorders and giving them a sound life. So today's topic is on hearing care as a part of World Hearing Day 2022. AIISH being a member of the World Hearing Forum of the World Health Organization, we have registered several activities um, for the World Hearing Day 2022 to promote ear and hearing care. So when it is going to be? So please mark the date. It is on March 3rd. So March 3rd is celebrated as the World Hearing Day by the WHO to raise public awareness about how to avoid hearing loss and to promote ear and hearing care. So this year it is focused on the importance of safe listening and maintaining good hygiene across the life course. Today we have two experts in this field, Dr. Devi and Dr. Sriraj, who are working as a faculty in the Department of Audiology, AIISH Mysore. They will be giving a lot of inputs on hearing care and safe listening. On behalf of the phone-in program organizers, I welcome you both.
Welcome.
So, Dr. Devi, so what is the age where hearing care can be started?
Um, when you say hearing care, actually it is not just as we think like we have to start thinking about the hearing care after the birth. Actually, this hearing care actually happens even much before the birth of a child. Okay, when we say the child actually can start hearing by the month of around 5 months of gestation. Okay, so when the child is in the womb itself, the child's ear parts will be completely developed, and the child can start hearing all the sounds that are there in the environment even much before the child is being born. Okay, so before the child is born, a lot of stimulation, auditory stimulation can be provided during this time of gestation itself, so that the brain development during the process of gestation can also happen simultaneously. So once when the child is born, the child is ready to listen to the environmental sounds and other sounds as well as the speech, and then the child starts learning to produce the spoken language. Okay, when we say about the hearing care about during this time period, it's very important that the mother takes care of good health during this gestational period, even much before the child is being born. Okay, so the mother should have a good nutritious food. The mother should take the medications as per the doctor's advice, and also the regular healthcare checkup has to be done regularly so that the developmental process of the ear happens in a correct way. Okay, so after once the child has been born, okay, the hearing care still continues. So, if the child has any cold or any other problems even after the birth, the ear care still continues along with that.
Okay, that's the good information. The hearing care starts even the child is in the during the pregnancy period itself. So the first step on the hearing care is the good nutritious food during the pregnancy period, and then the auditory stimulation during that period. So that's the first step which are supposed to follow it. And then now Dr. Sriraj, so Dr. Devi has said that the hearing care starts even at the pregnancy time. So as soon as the child is born, the baby is born. So how do you gonna take care of the ear?
The first concern is about whether the child is hearing at the time of birth. So we have to identify whether the child is hearing, and this can be done through the newborn hearing screening program, which is a program in the government of India. And there are many hospitals having this newborn screening program, and AIISH is having multiple centers around the country for newborn screening. So it's advisable to go for newborn screening before the child gets discharged from the hospital, so that the child can develop normal speech and language. Every day is important, as Dr. Devi said. Child is even hearing inside the womb. So already the child would have lost some period of time for proper hearing inside the womb itself. So every day counts, and the critical age of the child for developing speech and language is up to 3 years or 5 years of age. So this is very important to know that the child is hearing well at the time of birth, and with the screening need to be done immediately.
Okay. So the second tip on hearing care, what Dr. Shreyas has said is that get your baby's hearing tester. Okay. So Dr. Devi, generally when the babies are growing up, when they are in the children stage, okay, they usually get a frequent cold as well as they keep indicating that they have ear pain. So is there any connection between these two? And how do you want to take care of such conditions for children?
Yes, there is definitely a connection between the child getting a cold and then child also complains about the ear pain because we have a tube called eustachian tube which actually connects between our throat and then the ear. Okay, so any infection that happens at the throat, okay, or the upper respiratory tract, okay, which we call as upper respiratory tract infection, that even goes on to the middle ear also, okay, leading to having the ear pain in the ear. Okay.
So can I have a call on that? Hello. Hello, ಮಾತಾಡಿ. Hello. Can you hear us?
Hello.
Hello.
Yes, sir.
Yeah. Tell me, this is a phone-in program from AIISH.
Yes, sir.
So what do you wanted to ask us?
ಸರ್ ಅದು ನನ್ನ ಕ್ವೆಶ್ಚನ್ ಏನಿತ್ತು ಅಂತಂದ್ರೆ ನನ್ನ ಕಿವಿಯೊಳಗೆ ಯಾವಾಗ್ಲೂ ಏನಾದ್ರೂ ಇದೆ ಅಂತ ಅನ್ಸುತ್ತೆ ನನಗೆ. ಆದ್ರೆ ಕಾಟನ್ ಬಡ್ ಹಾಕಿ ಕ್ಲೀನ್ ಮಾಡಿದಾಗ ಕೆಲವೊಂದ್ಸಲಿ ಏನಾದ್ರೂ ಸಿಗುತ್ತೆ, ಕೆಲವೊಂದ್ಸಲಿ ಗುಡ್ಡಿ ಇರೋದಿಲ್ಲ. ಆದ್ರೂ ನಂಗೆ ಇಚ್ಚಿಂಗ್ ಸೆನ್ಸೇಷನ್ ಫೀಲ್ ಆಗುತ್ತೆ. ಅದು ಯಾಕಿರ್ಬೋದು ಸರ್?
Okay. So question ಏನಂದ್ರೆ what is the question is on the something in the ear, something like a foreign object or something like that. So she has cleaned several times, but still they have a itching sensation in the ear. So Dr. Devi can answer for this.
There could be many things we can think of, but when you say that even when you clean, it's like the wax has come, it's just the itching sensation. I think that it's better that you consult an ENT specialist and an audiologist. Because one thing is we are not supposed to use earbuds as such. That's which you should have avoided of not using the earbuds to clean your ears. Okay, but there are chances that there could be some foreign object into the ear. Okay, so ನಿಮ್ಮ ಕಿವಿಯಲ್ಲಿ ಏನಾದರೂ ಬೇರೆ ಏನಾದರೂ ಆ ಥರ ಏನಾದರೂ ಒಳಗಡೆ ಹೋಗೋಕ್ಕೆ ಚಾನ್ಸಸ್ ಇದೆ. ಸೊ ಅದಕ್ಕಿಂತ ಒಂದ್ಸತಿ ENT ಡಾಕ್ಟರು ಇಲ್ಲ ಆಡಿಯಾಲಜಿಸ್ಟ್ನ ಒಂದ್ಸತಿ ಬಂದು ಕನ್ಸಲ್ಟ್ ಮಾಡ್ಕೊಳ್ಳೋದು ಬೆಟರ್.
ಮ್ಯಾಮ್, ಅದು ಇಯರ್ಬಡ್ಸ್ ಕ್ಲೀನ್ ಮಾಡೋಕ್ಕಾಗಿಲ್ಲ ಅಂತಂದ್ರೆ ನಾವು ಬೇರೆ ಏನನ್ನ ಉಪಯೋಗಿಸ್ಕೊಂಡು ಕ್ಲೀನ್ ಮಾಡ್ಕೋಬಹುದು?
ಆಸ್ ಸಚ್ ನೀವೇ ಆ್ಯಕ್ಚುಲಿ ಕಿವಿನ ಇಯರ್ಬಡ್ಸ್ನ ಇಲ್ಲ ಬೇರೆ ಏನೋ ಐಟಮ್ಸ್ನ ಇಟ್ಕೊಂಡು ನೀವೇ ಕ್ಲೀನ್ ಮಾಡೋಕ್ಕೆ ಹೋಗಬಾರ್ದು. ನಮ್ಮ ಒಪಿನಿಯನ್ ಪ್ರಕಾರ ಅದನ್ನು ಅವಾಯ್ಡ್ ಮಾಡೋದು ಬೆಟರು. ಸೊ ನಿಮಗೆ ಏನಾದರೂ ಕಿವಿ ಬ್ಲಾಕಿಂಗ್ ಸೆನ್ಸೇಷನ್ ಇರೋ ಥರ ಇಲ್ಲ ಇರಿಟೇಷನ್ ಇರೋ ಥರ ಏನಾದರೂ ಅನಿಸಿದ್ರೆ ನೀವು ಇಮಿಡಿಯೇಟ್ ಫಸ್ಟ್ ಸ್ಪೆಷಲಿಸ್ಟ್ ಹತ್ರ ಬಂದು ಕನ್ಸಲ್ಟ್ ಮಾಡಬೇಕು. ನಾವು ನಮ್ಮ ಅಡ್ವೈಸ್ ಪ್ರಕಾರ ಕಿವಿ ಒಳಗಡೆ ಯಾವುದನ್ನು ಹಾಕಬಾರ್ದು. ಯಾಕೆಂದರೆ ನಮಗೆ ಮಧ್ಯ ಕಿವಿಯಲ್ಲಿ ಒಂದು ಡ್ರಮ್ ಇರುತ್ತೆ, ಇಯರ್ ಡ್ರಮ್ ಅಂತ. ಅದು ಎಷ್ಟು ದೂರದಲ್ಲಿ ಇದೆ ಅಂತ ನಿಮ್ಗೆ ಗೊತ್ತಾಗಲ್ಲ. ಸೊ ಅದು ಗೊತ್ತಾಗದೆ ನೀವು ಕಿವಿ ಒಳಗಡೆ ಏನಾದರೂ ಹಾಕಿಬಿಟ್ರೆ ಅದು ನಿಮಗೆ ಇಯರ್ ಡ್ರಮ್ ಪರ್ಫರೇಷನ್ ಆಗುತ್ತೆ, ಟೂತ್ ಆಗಿಬಿಡುತ್ತೆ. ಸೊ ಅದರಿಂದ ತುಂಬ ಇನ್ಫೆಕ್ಷನ್ಸು ಇಲ್ಲ ಪಸ್ ಬರೋಕ್ಕೆ ಅದೆಲ್ಲ ಶುರು ಆಗುತ್ತೆ. ಬೇರೆ ಬೇರೆ ಪ್ರಾಬ್ಲಮ್ಸು ಮತ್ತು ಕಿವಿ ತೊಂದರೆ ಎಲ್ಲ ಬರೋಕ್ಕೆ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಸೊ ಅದಕ್ಕಿಂತ ನಮ್ಮ ಅಡ್ವೈಸ್ ಪ್ರಕಾರ ಕಿವಿ ಒಳಗಡೆ ಯಾವುದೂ ಹಾಕ್ತೇ ಇರೋದನ್ನೇ ಒಳ್ಳೆಯದು. ಆಯಿತಾ? ನಿಮಗೆ ಇರಿಟೇಷನ್ ಇರ್ತಾ ಇದೆ ಅಂದರೆ ಡೆಫಿನೆಟ್ ಬಂದು ಸ್ಪೆಷಲಿಸ್ಟ್ ಹತ್ರ ಕನ್ಸಲ್ಟ್ ಮಾಡ್ಕೊಳ್ಳಿ.
So clear ಆಯ್ತಾ?
Yes, sir.
Thank you. Okay, so we're talking about the eustachian tube and the cold apparatus infection. So
as I was telling, there is definitely a connection between the throat pain or the cough or the cold, whatever the child has, and then the ear pain what the child gets, because there is a connecting tube between that. And the problem is it's not as simple as we say it's just the ear pain. okay, because the infection in the throat can definitely enter into the middle ear, okay, and then it can collect as a pus, okay, and this pus can lead a rupture to your eardrum, okay. So if this rupture happens, there are high chances that this child can get into a hearing loss. Okay, it's not just only the hearing loss that it can happen. If this continues to repeatedly happen, like the child getting cold and then it's not being taken care, the child gets ear infection, then there are chances that the child understanding something or the speech, the perception, the processing difficulty might also happen. Okay, so it's a very serious issues. So we advise the parents not to neglect if at all the child has throat pain and then cough. Okay, along with that the child exhibits any blocking sensation or ear pain, to definitely get the child to get consulted with an audiologist and the ENT specialist. Okay.
So the cold is not a simple thing, so we have to consult immediately the doctors, right?
Yes.
So the third tip is on hearing care is, so consult the doctor immediately when you get ear pain or something like a discharge of water in the ear. So remember that. So Dr. Sriraj, so generally for a children like that, so apart from cold or the ear pain what is happening to it, the wax is the most common problem which is being seen. And what we do is we clean ourselves or do something to take out the wax. Is it safe to do it?
See, this is one very wrong understanding, and it's a very common thing. Any supermarket you go, you will get earbuds,
Yeah.
and they use it for different purpose, but still, we call it as earbuds. Okay, cotton swabs or buds, whatever. And the wrong concept is that when we clean the ear, it is a good thing. But for the audience, you have to understand this particular wax, what is there inside the ear, has antibacterial, antifungal properties, and this is going to keep the ear clean and avoid from getting infections. So when water goes inside, it's like a oil what is there inside at the starting of the ear canal. So that prevents actually accumulation of water, and it helps to stop the infections that can be happening at that particular point. That's one thing. Pick the card and conclude.
Hello. Matadi. Hello. Can you hear us? ಕೇಳಿಸಿದೆಯಮ್ಮ?
ಹಲೋ
ಹಲೋ. ಹೇಳಿ, ಐಶಿಂದ ಫೋನ್ ಇನ್ ಪ್ರೋಗ್ರಾಮ್ ಇದು, ಮಾತಾಡಿ.
சார் நான் சென்னையில இருந்து போன் பேசுறேன்.
சொல்லுங்க.
காதுல இயர்போன்ஸ் போட்டுட்டா கொஞ்ச நேரம் கழிச்சுட்டு ஒரு மாதிரி சத்தம் வருது காதுல இருந்து.
ஓகே.
இயர்போன்ஸ்னா அதெல்லாம் எவ்வளவு யூஸ் பண்ணணும், அது எந்த வால்யூம்ல யூஸ் பண்ணணும், அது பத்தி தெரிய மாட்டேங்குது.
ஓகே ஓகே. ஸோ டாக்டர் ஸ்ரீராஜ் அவங்க ஆன்சர் பண்ணுவாங்க. டாக்டர் தேவி அவங்க ஆன்சர் பண்ணுவாங்க. ஸோ
இந்த கொஸ்டின் ஆக்சுவலாக ரொம்ப நிறையா பேருக்கு தெரிய வேண்டிய விஷயம் இது என்னென்னா, ஆக்சுவலாக ஃபஸ்ட்டு இயர்ஃபோன்ஸு எவ்வளோ உங்களுக்கு அவாய்ட் பண்ண முடியுமோ அவ்வளோக்கு நீங்கள் அவாய்ட் பண்ணுறது நல்லது, சரியா? ஏன்னா எதனால் நாங்கள் சொல்கிறோம்னாலே இந்த மாதிரி சவுண்டு வரும், பின்ன காதுலேருந்து சவுண்டு வரும், பின்ன காது வந்து அடைச்சிக்கிற மாதிரி இருக்கும், இல்லை காதுலேருந்து இரிட்டேஷன் ஆகும், இல்லை இந்த போர்ஷன் இயர்ஃபோன்ஸ் போடுறப்ப இந்த போர்ஷனில் எல்லாம் வந்து இன்ஃபெக்ஷன் ஆகிறதுக்கு சான்சஸ் இருக்குது. ஏன்னா அதே ஃபோன்ஸை யூஸ் பண்ணீங்க திரும்ப வெளியில் வைக்கிறீங்க. ஸோ இந்த மாதிரி இயர்ஃபோன்ஸு ஹெட்ஃபோன்ஸ் யூஸ் பண்ணுறதுனால நிறைய ப்ராப்ளம்ஸ் வருது. ஓகே, அது மட்டும் இல்லாமல் காது கேட்குற இந்த இயர்ஃபோன் யூஸ் பண்ணுறதோ இல்லை ஹெட்ஃபோன்ஸ் யூஸ் பண்ணுறதோ கண்டினியூ ஆச்சுன்னா, ஓகே, காது கேட்குறதுக்கு ப்ராப்ளமும் பின்னாடி வர்றதுக்கு சான்சஸ் ரொம்ப அதிகமாக இருக்குது. அதனால் நாங்கள் என்ன அட்வைஸ் பண்ணுறோன்னா, இயர்ஃபோன்ஸு உங்களுக்கு யூஸ் பண்ணுறதை தவிர்த்துட்டு ஸ்பீக்கரில் கேட்குறது பெட்டர் ஆப்ஷன். இல்லை உங்களுக்கு இயர்ஃபோன்ஸே யூஸ் பண்ண வேண்டியது இருக்குது, கட்டாயமாக இருக்குன்னா நீங்கள் வால்யூமாக கம்மியாக வச்சுக்கணும். ஓகே, வால்யூம் உங்களுக்கு எந்த லெவலில் வச்சா லைக் மெதுவாக, இப்போ நான் பேசுகிறது மெதுவாக இருக்க சவுண்டு கேட்குதோ அந்த லெவலில் வச்சுட்டு நீங்கள் யூஸ் பண்ணுறது பெட்டரு. ஆனால் ஜஸ்ட் சொன்னோன்றதுக்காக ஃபுல்லாக லெவல் கம்மியாகவே வச்சுட்டு யூஸ் பண்ணிக்கிட்டே இருக்கக்கூடாது. கொஞ்சம் டைம் கேப் நடுவில் விடணும். லைக் ஒரு 10 மினிட்ஸோ 15 மினிட்ஸோ யூஸ் பண்ணிவிட்டு நிப்பாட்டிட்டு திரும்ப மேபி ஒரு 1 ஹவர் இல்லை ஒரு ½ அன் ஹவருக்கு அப்புறம் திரும்ப யூஸ் பண்ணணும். நடுவில் கேப் விட்டு யூஸ் பண்ணுங்கள். பின்ன வால்யூம் கம்மியாக வச்சுக்கோங்க. முடிஞ்ச அளவுக்கு இயர்ஃபோன்ஸ் ஹெட்ஃபோன்ஸ் அவாய்ட் பண்ணிவிட்டு ஸ்பீக்கரில் கேட்குறதுக்கு ட்ரை பண்ணுங்க. சரியா? ஏன்னா இதோட விளைவுகள் வந்து நிறையா இருக்கும். இம்மீடியட்டாக உங்களுக்கு அந்த விளைவுகள் தெரியலனாலும் யூஸ் பண்ண பண்ண காது கேட்குறதுக்குரிய ப்ராப்ளமோ இல்லை இந்த மாதிரி சிம்டம்ஸு, காது அடைக்கிற ப்ராப்ளமோ இல்லை காது இரிட்டேஷன் ஆகுறதோ இல்லை குயின்னு சவுண்ட் வர்றது, இந்த ப்ராப்ளம்ஸ் எல்லாம் பின்னாடி வந்தால் நாங்கள் இதை வந்து ட்ரீட்மெண்ட் பண்ணுறதுக்கு வந்து ரொம்ப கஷ்டமாக இருக்கும். சரி, அதனால் ப்ரிவென்ஷன் பண்ணுறதுக்கு முடிஞ்ச அளவுக்கு ட்ரை பண்ணுங்க, இந்த மாதிரி காது ரிலேட்டட் ப்ராப்ளம்ஸ் வராமல் இருக்கிறதுக்கு. வேறு ஏதாவது கொஷின்ஸ் இருக்கா, டவுட்ஸ் இருக்கா இதில்?
இல்லை மேம், அவ்வளோதான்.
தேங்க்யூ.
Okay, thank you.
Thank you.
Yes, Sri.
So we're talking about wax and whether it is required to be cleaned. So my advice is not to clear the wax. Okay, but in children sometimes what you can see, there can be complete blockage, especially in the growing stages up to 5 years, 6 years, or maybe within 10 years. There is high chance that there is wax accumulation. That if you just pull the canal, if you pull the ear and just watch, you can see black completely occluded here, and the child will complain about not hearing clearly. That is the time when you have to intervene into this matter, and that is the time you have to go to an ENT specialist. Never do a cleaning of wax by yourself, because when we try to clean it, when we use swabs, every time the wax is pushed inside and it goes and collects near the tympanic membrane.
Okay. Sure. Hello, AIISH phone in program. Hello. Hello.
Hello.
Yeah, AIISH phone in program. Yeah, tell me.
Good afternoon, sir. My child is having a multiple disability in which she is a hearing impaired child with a 70 dB loss.
Okay.
I want to know one thing. She has just started speaking. Now she's in 2 words, 3 words. Sometimes she says full sentence also. But being a mother, I can only understand what she is saying. Basically, her speech clarity is not there.
Okay. Okay.
Sometimes middle words are missing. Sometimes last words are missing. Basically, something like that.
Okay.
So, what will be our next step? How to move further to bring the speech clarity?
Okay. So we'll answer your questions. Dr. Sriraj, you can.
May I know whether the child is wearing hearing aid?
Yes, phonic hearing aid she is using.
Okay. And when was the last time hearing was tested?
Hearing was tested in 2013 and 14. In the month of November, we came to AIISH, MYSURU.
Okay.
But the child did not support us. She did not speak. We failed to this test for para test.
Okay. And what is the current age of the child?
She is 9 years, 3 months.
Okay. Okay. And the thing is, once the child is having hearing loss, the improvement and how the child progresses in life purely depends on the amount of training that is given to the child. The speech and language therapy, how efficiently it is given, and how well the child is able to pick up that and then learn. And definitely you can accept some amount of misarticulation or unclarity in the speech. That is a part of it if you have 70% hearing loss. But other than that, most of the sounds, if a proper rehabilitation and therapy is given, the child should be able to produce. So have you taken her for speech therapy?
Yes, we are taking it online.
Okay, currently, and from beginning it was going on?
From not beginning, she's having a multiple disability from last 4-5 years.
Okay.
But unfortunately, in Delhi, we did not get the best speech therapist. From last 2 years, I am taking therapy from Bangalore now.
Okay, online you're taking. Okay,
Yes.
so I would advise to continue that and discuss the problems with the speech therapist, and they would definitely be able to help you with it. I won't say the child will be able to speak 100% normally, That purely depends on the intellectual level of the child. You told the child is having multiple disability, etc. But they will definitely be able to help you. The only thing what you can do is to give a proper speech therapy and don't stop it. In between, don't discontinue that.
Sir, I just, with your talk, I just understand one thing, that continuous speech therapy. But my next question is, if my speech therapist is, that suppose my daughter is not saying something clearly,
Yeah.
so with slow motion, I have to repeat it. I don't use word no, na, something no.
Okay.
I have to just correct in a very positive way.
Okay.
But after correcting also, if the child is not able to speak that word clearly, then then I got stuck. I don't know how to move further.
Yeah. So this is the thing, that's what I'm telling you. So there are specialists, right? So we are trained into giving speech therapy, speech and language stimulation, articulation correction, okay, language training and all that. So those people you have to correctly contact them, and then probably the child will start improving much better. I understand as a parent it may be very difficult because you are not into the field. Okay, so I would advise you to take proper effective care from a good qualified speech and language pathologist. They will be helping you with it.
Okay. Thank you, sir. Thank you
Yeah.
very much.
Thank you.
Yeah, thank you for the call.
Thank you.
Yeah.
Okay.
So,
So
relax.
wax, yeah. So wax need not be cleaned. And if at all there is blockage, if there is pain, it is good to consult an ENT. They will give drops basically to dissolve the wax, and then they might do suction or some procedures similar to that, and then get the wax removed completely. So that is the only time when wax has to be cleaned. So it is not on a regular basis that you have to use earbuds and clean it. And also understand that in the ear there is a natural mechanism by which the wax is removed. So automatically you can see flakes in the starting of the ear canal. So that is all dust particles, wax and everything mixed together. So that is a natural mechanism by which the wax is removed by the ear. So I would advise not to go for wax removal, and if at all it needs to be removed, if you feel hearing loss is starting, you cannot hear, the ear is blocked, consult an ENT immediately.
Okay, so you mean to say the wax is a normal thing that has to be there.
It has to be there.
When it is blocked, then you have to go for a
Consultation.
consultation. Okay, that's great. So the fourth tip on the hearing care is avoid self-cleaning of ears. So don't put sharp objects, something like that, and clean your ears on your own. Consult the doctors for it. Okay. So the next thing is just now we got even a call regarding this. These days, mobile phones have been a part of our life, and we keep listening to songs and then talking to the well-wishers for a longer time, and then even the adults who have been traveling, they usually put their headphones and start listening to the songs. Okay, will that affect our hearing?
Yes, all of us have been using this technology nowadays, and we have been listening to music, we have been listening to class lessons, and so many for other users. You may not be able to notice the impact of this using of earphones or headphones immediately at present. Okay, but over a period of use, okay, you might get into many problems in terms of like ear irritation or any infection in the external ear. Not only in the external ear, the problem can go on to the inner ear also, which can give you a permanent damage. When you see if there are any infections which is outside because of the use of the earphones or headphones, there could be just redness of the ear and your external that might go off with medications. But if the prolongation of the use of earphones or headphones continues, okay, it might reach the inner ear, okay, which will lead into a permanent damage, which is very difficult for us to correct it or get it back to the normal. Okay, so you may not notice the hearing loss as such, but you might feel it like not able to perceive some sounds in the presence of the noise, or you might get a sound like a whoo, which keeps getting into your ear every time. Okay, so these kind of symptoms you might notice. So initially, if you feel any symptoms like this, immediately consult an audiologist and a specialist, and then take care of yourself. Okay, because these things are preventable. Okay, if you prevent all these aspects, we can definitely save your ears from any permanent damage related to hearing problems.
So But what is the volume we can keep it? You say.
Yeah, in some unavoidable circumstances, we might have to use earphones or headphones. So, as I had already told to one of the callers also, I advise that preferably go to the speaker mode, or if not possible, then use it at a very low volume. Okay, so that it does not it does not affect your inner ear and get into permanent damage, and the duration of the hours of using that also should be reduced. Don't use it for a very longer duration. Okay, use it for a shorter period at a very lower volume. That will save your ears.
Yes, that's a good suggestion. So even these days, Android phones, all those things, when you increase the volume, I think it indicates that it is beyond the danger zone, right? So we should be able to cut down lesser than that.
Even if you keep it at a much lower level of the indication level, it's always good for the ears.
Okay, okay. So we'll pick the call. Hello, AIISH phone in program. Hello. Hello, you can speak.
Hello.
Yeah.
ಸರ್ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ ನಾ ಮಾತಾಡ್ತಿರೋದು?
ಕೇಳಿಸಿದೆ ಅಮ್ಮ, ಹೇಳಿಮ್ಮ.
ಇದು ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್ ಅಲ್ವಾ?
ಹೌದು, ಈ ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್ ಫೋನ್ ಇನ್ ಪ್ರೋಗ್ರಾಮ್ ಅಮ್ಮ, ಮಾತಾಡಿ.
ಸರ್, ನನಗೆ ಇವಾಗ ಆನ್ಲೈನ್ ಕ್ಲಾಸ್ ತುಂಬಾ ನಡೀತಿದೆ.
ಓಕೆ.
ಅದ್ರ ಜೊತೆಗೆ ನಂಗೆ ಮ್ಯೂಸಿಕ್ ಅಂದ್ರೆ ತುಂಬಾ ಇಷ್ಟ. ಸೊ ತುಂಬಾ ಮ್ಯೂಸಿಕ್ ಕೇಳ್ತಾ ಇರ್ತೀನಿ ಹೆಡ್ಫೋನ್ಸ್ ಹಾಕೊಂಡು.
ಓಕೆ.
ಮುಂಚೆ ಸ್ವಲ್ಪ ಕಡಿಮೆ ವಾಲ್ಯೂಮ್ ಅಲ್ಲಿ ಕೇಳಿಸ್ಕೊತಾ ಇದ್ದೆ. ಇವಾಗ ನನ್ಗೇನು ಫೀಲ್ ಆಗ್ತಾ ಇದೆ, ಸ್ವಲ್ಪ ವಾಲ್ಯೂಮ್ ಜಾಸ್ತಿ ಮಾಡಿದ್ರೇನೆ ನನ್ಗೆ ಅಂದ್ರೆ ಯುನೋ ದಟ್ ಫೀಲ್ ಗುಡ್ ತರ ಅನ್ಸುತ್ತೆ ಮ್ಯೂಸಿಕ್ ಕೇಳಿದಾಗ. ಮುಂಚೆ ಅಂದ್ರೆ ಕಡಿಮೆ ವಾಲ್ಯೂಮ್ ಅಲ್ಲೂ ಐ ವುಡ್ ಎಂಜಾಯ್ ದ ಮ್ಯೂಸಿಕ್.
ಓಕೆ, ಓಕೆ.
ಸೊ ಐ ಥಾಟ್ ಮೇಬಿ ಯು ಪೀಪಲ್ ಕ್ಯಾನ್ ಗೈಡ್ ಮೀ ಏನ್ ಮಾಡಬೇಕು ಎಕ್ಸಾಕ್ಟ್ಲಿ ಅಂತ ಇದ್ರ ಬಗ್ಗೆ.
ಓಕೆ, ಸೊ ಇದನ್ನ ಪ್ರಕಾರನೇ ಈ ಕ್ವಶನ್ಸ್ ಅಲ್ಲಿ ನಡೀತಾ ಇದೆ. ಸೊ ಕಂಟಿನ್ಯೂ ಮಾಡ್ತಾರೆ ಡಾಕ್ಟರ್ ದೇವಿ ಅವರು, ಈ ಮಾಹಿತಿ ಕೊಡ್ತಾರೆ.
ಓಕೆ ಸರ್, ಥ್ಯಾಂಕ್ ಯು.
Actually, this is what I was exactly telling you just now. Like ಸ್ಟಾರ್ಟಿಂಗ್ ಅಲ್ಲಿ ನಿಮಗೆ ಗೊತ್ತಾಗಲ್ಲ ಕಿವಿ ತೊಂದರೆ ಬರ್ತಾ ಇದೆ ಅಂತ. ಸ್ಟಾರ್ಟಿಂಗ್ ಅಲ್ಲಿ ನಿಮಗೆ ಕಂಫರ್ಟಬಲ್ ಅನ್ಸುತ್ತೆ, ಬಟ್ ಒಂಚೂರು ಕೆಲವು ದಿನ ಆದಮೇಲೆ ನಿಮ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ ನಾವು ವಾಲ್ಯೂಮ್ ಜಾಸ್ತಿ ಮಾಡಿದ್ರೆ ಮಾತ್ರ ನಮ್ಗೆ ಚೆನ್ನಾಗಿ ಕೇಳಿಸ್ತಾ ಇದೆ ಅಂತ. ಸೊ ಅದು ಇಂಡಿಕೇಶನ್ ನಿಮಗೆ ಆಲ್ರೆಡಿ ಅದ್ರದ್ದು ಇಯರ್ಫೋನ್ಸ್ ಹೆಡ್ಫೋನ್ಸ್ ಯೂಸ್ ಮಾಡಿರೋದು ಎಫೆಕ್ಟ್ ಬರೋಕ್ಕೆ ಶುರು ಆಗಿದೆ ಅಂತ ಒಂದು ಅರ್ಥ. ಸೊ ಈಗ ನೆಕ್ಸ್ಟ್ ನೀವೇನು ಮಾಡಬೇಕಾದ್ರೆ ಫಸ್ಟ್ ನೀವು ಆಡಿಯಾಲಜಿಸ್ಟ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಿ ನಿಮ್ಮ ಕಿವಿ ತೊಂದರೆ ಬಂದಿದೆಯಾ ಇಲ್ವಾ, ನಿಮ್ಮ ಕಿವಿದು ಕೇಳಿಸ್ಕೊಳ್ಳೋದು ಲೆವೆಲ್ ನಾರ್ಮಲಲ್ಲಿ ಇದೆಯಾ ಇಲ್ವಾ ಅನ್ನೋದನ್ನ ಫಸ್ಟ್ ಚೆಕ್ ಮಾಡ್ಕೋಬೇಕು. ಓಕೆ, ಅಕಸ್ಮಾತ್ ಏನಾದರೂ ಎಫೆಕ್ಟ್ ಆಗಿದ್ದರೆ ಓಕೆ, ನಾನು ಇದಕ್ಕೆ ಮುಂಚೆನೇ ಹೇಳಿದ ಥರ ಇಯರ್ಫೋನ್ಸು ಇಲ್ಲ ಹೆಡ್ಫೋನ್ಸ್ನ ಉಪಯೋಗಿಸೋದನ್ನ ಸ್ವಲ್ಪ ಕಡಿಮೆ ಮಾಡಿ. ಓಕೆ, ವಾಲ್ಯೂಮ್ ಜಾಸ್ತಿ ಇಟ್ಕೊಳ್ಳೋದನ್ನ ಕಡಿಮೆ ಮಾಡಿ. ಓಕೆ, ನಿಮ್ಗೆ ಆದಷ್ಟು ಅಳವು ಸ್ಪೀಕರಲ್ಲಿ ಹಾಕೊಳ್ಳಿ. ಓಕೆ, ಇಯರ್ಫೋನ್ಸ್ ಹೆಡ್ಫೋನ್ಸ್ನ
ಇವಾಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಅಕ್ಕಪಕ್ಕ ತುಂಬಾ ನಾಯ್ಸ್ ಇದ್ದಾಗ ಟೆಂಡೆನ್ಸಿ ಇದ್ದೇ ಇರುತ್ತೆ ಅಲ್ವಾ ಹೆಡ್ಫೋನ್ ಹಾಕೊಳ್ಳೋದು. ಸೊ ಅದನ್ನ ಹೇಗೆ ಪ್ರಿವೆಂಟ್ ಮಾಡೋದು?
ಅದೇ ನಾನು ಅನ್ಅವಾಯ್ಡಬಲ್ ಸರ್ಕಮ್ಸ್ಟೆನ್ಸ್ ಇರುವಾಗ ನೀವು ಇಯರ್ಫೋನ್ಸ್ ಯೂಸ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ಬಟ್ ಅದು ಆ ಥರ ಇರೋ ಸಿಚುವೇಶನ್ನಲ್ಲಿ ನೀವು ಮ್ಯೂಸಿಕ್ಕು ಇಯರ್ಫೋನ್ಸನ್ನು ಕೇಳ್ಕೊಳ್ಳೋದನ್ನ ಅವಾಯ್ಡ್ ಮಾಡಿಕೊಂಡು ಆ ನಾಯ್ಸ್ ಸಿಚುವೇಶನ್ ಇಲ್ಲದೇ ಇರುವಾಗ ಕೇಳ್ಕೊಬೋದು. ಆ ಥರ ನಿಮ್ಮ ಸಿಚುವೇಶನ್ನ ಎನ್ವಿರಾನ್ಮೆಂಟ್ನ ಚೇಂಜ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಯಾಕಂದರೆ ಇದು ಒನ್ಸ್ ಕಿವಿದು ಎಫೆಕ್ಟ್ ಬಂದುಬಿಟ್ಟಿದ್ರೆ ಇದು ರಿವರ್ಸಬಲ್ ಇಲ್ಲ. ಓಕೆ, ಪುನಃ ನಾವು ನಾರ್ಮಲ್ ಇಯರಿಂಗ್ಗೆ ತಗೊಂಡು ಹೋಗೋಕ್ಕಾಗಲ್ಲ. ಅದನ್ನೇ ನಾನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ. ಸೊ ಆದಷ್ಟು ಅವಾಯ್ಡ್ ಮಾಡಿ. ಯೂಸ್ ಮಾಡಬೇಕಾದ್ರೆ ಕಡಿಮೆ ವಾಲ್ಯೂಮಲ್ಲಿ ಇಟ್ಕೊಳ್ಳಿ. ನಾಯ್ಸ್ ಇಲ್ಲದೆ ಕಡೆ ಸ್ಪೀಕರಲ್ಲೇ ಹಾಕ್ಕೊಂಡು ಕೇಳ್ಕೊಬೋದು. The same thing, whatever you are listening through earphones and headphones are definitely can be heard through speakers.
Right.
Yes. So ಆದಷ್ಟು ನಿಮ್ಮ ಇಯರ್ಸ್ನ ಸೇವ್ ಮಾಡಬೇಕಂತಂದರೆ ಈ ಟಿಪ್ಸ್ನ ಫಾಲೋ ಮಾಡಿ. ಯಾಕಂದರೆ ಈ ಪ್ರಾಬ್ಲಮ್ಸ್ ನಿಮಗೆ ಇಮಿಡಿಯೇಟ್ ಗೊತ್ತಾಗಲ್ಲ. ಕೆಲವೊಂದು ವರ್ಷ, ಒಂದು 1 year ಇಲ್ಲ 2-3 years ಆದಮೇಲೆ ಅದು ಗೊತ್ತಾಗೋದು. ಸೊ ಆ ಲೆವೆಲ್ಗೆ ಬರುವಾಗ ನಾವು ನಮ್ಮ ಕಡೆಯಿಂದ ಹೆಲ್ಪ್ ಮಾಡೋದು ತುಂಬ ಕಷ್ಟ ಇರುತ್ತೆ.
ನೀವು ಮ್ಯೂಸಿಕ್ ಲವರ್ಸ್ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀರಾ. ಸೊ ಇನ್ನೂ ಜಾಸ್ತಿ ಟೈಮ್ ಮ್ಯೂಸಿಕ್ ಕೇಳಿಸ್ಕೋಬೇಕಂದ್ರೆ ಸೇಫ್ ಟಿಪ್ನ ಫಾಲೋ ಮಾಡಿ. ಡೋಂಟ್ ಕೀಪ್ ಲಿಸ್ನಿಂಗ್ ಫಾರ್ ಲೌಡ್ ಸೌಂಡ್ಸ್. ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಫಾರ್ ಕಾಲಿಂಗ್. ಯಾ, fine. So music related question ಬಂತು ಅದೇ ಕಾಲು ಬಂತು. ಸೊ ನೆಕ್ಸ್ಟ್ ಸೊ ನೀವು ಅಷ್ಟು ಮ್ಯೂಸಿಕ್ನ ಲೌಡ್ ಸೌಂಡ್ಸಿಗೆ ಕೇಳಿಸ್ಕೋಬೇಡ. ವಿ ಆರ್ ಸೇಯಿಂಗ್ ದಟ್ ದಿ ಮ್ಯೂಸಿಕ್ ಶುಡ್ ನಾಟ್ ಬಿ ಹರ್ಡ್ ಫಾರ್ ಅ ಲಾಂಗರ್ ಟೈಮ್. ಸೊ ಕೇಳಿಸ್ಕೋಬೇಡ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಸೊ ಬಟ್ there are situations where professionals are working in the noisy environment. You may have seen industrial workers, construction workers, where they keep listening to loud sounds. So, what you want to say with that? So we just come to the hello, hello, AIISH phone in program. Hello.
Hello, sir.
Yeah, hey.
I'm Riddhi from Delhi. I'm again calling you. My next question is, like I discussed with you, my child is having a multiple disability. She's microcephaly. In multiple disability, she had a 4 holes in her heart, which was operated out. ASD, VSD, PDA.
Okay.
Now it is closure. There is no heart problem.
Okay.
My question is, at what age cochlear implant is good for the child, and what are the successful rates of cochlear implant, and how it affects the speech after we do go for cochlear implant? What are the impacts on the speech?
Okay, fine. So Dr. Devi will be answering to your question.
Okay.
Yes, Mrs. Riddhi, you said that your child is already 9 years old.
Yeah.
Okay. First, to think about cochlear implantation, we need to evaluate whether the child is a candidacy or not. Okay. Whether the child is going to get benefit much higher than whatever the child is getting with the hearing aid. Okay. With pertaining to your child, you have already told that the child has multiple problems. The child had already underwent heart surgery. Okay.
Yeah.
And also you said that the child, the degree of hearing loss was also, I think, severe hearing loss.
70 dB.
70 dB. So the child still has some amount of residual hearing. Okay, it's not that the child has lost more than 90 dB where there is no hearing from the child itself. Okay, so we need so many test batteries to check whether this child is going to definitely get much more better benefit than the hearing aid whatever the child is having. Okay, so keep that in mind. So with my opinion, I will feel that the child, for this child, we might not advise as such for a cochlear implant because the child has already multiple problems. Okay, whatever benefit the child gets with the hearing aid, okay, we can try to improve on the child's speech and language and the articulation based on the hearing level whatever the child has the residual hearing. Okay, and the child is already 9 years also. Okay, so the younger the child is fitted with a cochlear implant, the benefits are more. Okay, but there are also some circumstances where the child can be fitted with cochlear implant even at a later age if at all the child had developed hearing loss at a later stage. Okay, so there are so many factors which we need to evaluate as a holistic way for us to decide whether this child is definitely can go in for a cochlear implant and the child might get a better benefit or not. Okay, so just with verbal conversation,
Yes, you go ahead, ma'am.
it's difficult for us to come to a conclusion and then just guide you that your child can go in for cochlear implant. It's not all that easy. Okay, you can definitely come to AIISH, okay, and then get your child tested, evaluated, take us our opinion. Okay, and then we can definitely discuss in detail whether the child can go in for a cochlear implant or not.
Okay. I just want to ask one thing more. Like, it's been 9 years now. We are not able to go to any function or any where the pitch is very loud. My daughter got scared. She feels uncomfortable. She starts crying. She's not able to tolerate high volume, high pitch voices. Even in function, even at home also, we can't speak in a high pitch. So how should I correct this thing? What is the right procedure to get the child
Yes, we got it.
able to able to tolerate all these high pitch or high volume voices?
Yes, madam, we got it. Yeah.
Actually, this is more to do with the programming of the hearing aid. Okay, you said that the child is already wearing a hearing aid, we can definitely program the hearing aid wherever whichever sound she is uncomfortable. We can definitely reduce the volume of that particular frequencies and for her to listen better. Okay, so please go and visit an audiologist, consult an audiologist, get the hearing aid programmed once again, appropriate for her hearing loss. Okay, that will definitely solve the issue.
Okay, ma'am.
Okay, so this is not going to be a final decision. So until we see the client, see the report, we cannot say it. But you can take this as the kind of an information where you can go to the clinic and then finalize whatever you wanted to do for the child. Thank you.
Okay, got it, sir. Thank you so much.
Yeah.
Thank you.
Yeah, talking about industrial workers,
Industrial
noise.
workers. So industrial workers, they work in very loud noises. And it's a very known fact that, big machineries, boilers, iron plants, all those places we have lots of, noise for the production purpose. So, they are compromising their hearing when they're working there. And it's a very difficult scenario to, protect it, because there are not too many controls and, regulations that are presently in India, and especially in unorganized sectors, it is like not at all there. So it is required that they use some form of ear protector, and ear protectors, I have few samples here. I hope you can see it. This is called as ear muff, and these are ear plugs. These are ear plugs. This is also a type of ear plug. Okay, I'll just show it. This is a form of ear plug what is there. So when these workers work in loud noises, how to identify is that when you talk to the next person, you're finding it very difficult to make him understand what he is saying, or you cannot understand him saying. So that is very well clear that the loudness is very high there. In such instances, it is always good to use these kinds of ear protective devices. There are multiple variants, of ear protective devices what are there. So you can use any of these kinds of ear protective devices, and these are very cheap also. One pair will cost 6 rupees or 10 rupees, something like that. And these are disposable ones, but still if you maintain hygiene, you can use it for some period of time. And these ear protectors are going to safeguard the ear, and this helps the individual to ensure that they hear for a longer period of time. So this is one advice that I want to give. These kinds of devices can be used in order to safeguard the hearing of workers who are working in industrial sector.
Okay, so we have a call. Hello, AIISH phone-in program. Hello.
ഹലോ ഞാൻ ലൈവ് കൊണ്ട് വിളിക്കുന്നതാണ്, കേരളത്തിൽ നിന്നാണ് വിളിക്കുന്നത്.
സംസാരിക്കുന്നുണ്ട്.
എന്റെ അച്ഛന് മുന്നേ ഞങ്ങൾ ഇതുപോലെ ഹോസ്പിറ്റലിൽ കാണിച്ചു കഴിഞ്ഞപ്പോൾ അവരൊരു കേൾവിക്കുറവുണ്ടെന്ന് പറഞ്ഞായിരുന്നു. അപ്പൊ അവര് പറഞ്ഞു കേൾവിക്കുറവിന് വേണ്ടിയിട്ട് ആ മെഷീൻ വെക്കണം എന്ന് പറഞ്ഞു. പക്ഷെ അതിന് ഭയങ്കര പൈസയായിരുന്നു അന്നവര് പറഞ്ഞത്. അത് കഴിഞ്ഞപ്പോ ഞങ്ങൾ ഓൺലൈനായിട്ട് വിലക്കുറവിൽ ഇത് കിടക്കുന്ന കണ്ടു, കേൾവി സഹായി. അപ്പോ ഇത് തമ്മിൽ എന്താ വ്യത്യാസം? അത് മേടിച്ച കുഴപ്പമുണ്ടോ ഓൺലൈനായിട്ട്?
Okay, Dr. Sriraj will answer for this.
നിങ്ങൾ ഒരു സാധാരണ എന്തെങ്കിലും ഒരു സാധനം ആമസോണിൽ വാങ്ങിക്കുന്ന പോലെ വാങ്ങിക്കുന്ന സാധനമല്ല ഹിയറിംഗ് എയ്ഡ്. കാരണം പ്രത്യേകം ശ്രദ്ധിക്കേണ്ടത് എന്താ വെച്ചാൽ, ഒരു ക്വാളിഫൈഡ് ആയിട്ടുള്ള ഓഡിയോളജിസ്റ്റ് വേണം, അത് കറക്റ്റായി പ്രോഗ്രാം ചെയ്യണം, കേൾവിക്കുറവ് എത്രയാണെന്നുള്ളത് അറിയണം, അതിന് കണക്കായിട്ട് വേണം നമ്മളെ ഹിയറിംഗ് എയ്ഡ് പ്രോഗ്രാം ചെയ്ത് യൂസ് ചെയ്യാൻ വേണ്ടിയിട്ട്. അപ്പോൾ ഈ വില മാത്രം നോക്കി അത് ചെയ്യാൻ നിന്ന് കഴിഞ്ഞാൽ ചെവീൻ്റെ അവസ്ഥ എന്താവും നമുക്ക് പറയാൻ പറ്റില്ല. കാരണം പ്രോഗ്രാമബിൾ ഹിയറിംഗ് എയ്ഡ്സ് ആണ് കൂടുതലായിട്ട് ഇപ്പോൾ വരുന്നത്. അത് കേൾവിക്കുറവിനനുസരിച്ചിട്ട്, നമ്മളെ കേൾവി എന്ന് പറഞ്ഞാൽ 20 മുതൽ 20,000 ഹേർട്സ് വരെയുള്ളൊരു ശ്രേണിയാണ്. അപ്പോൾ അതിൽ ഏതൊക്കെ രീതിയിലാണ്, എവിടെയൊക്കെയാണ് ലോസ് എന്നുള്ളത് കണ്ടുപിടിച്ച് അതിന് വേണ്ട കറക്റ്റായിട്ടുള്ള പ്രോഗ്രാമിംഗ് ചെയ്തിട്ട് വേണം ഹിയറിംഗ് എയ്ഡ് യൂസ് ചെയ്യാൻ. ഇല്ലെങ്കിൽ അത് കൂടുതൽ ദോഷം ചെയ്യുക, ചെവീൻ്റെ കോശങ്ങളെ നശിപ്പിക്കുക ചെയ്യുക. അപ്പോൾ അത് കേൾവിക്കുറവിനെ കൂട്ടാനുള്ള സാധ്യതയുണ്ട്. അപ്പം കഴിയുന്നതും അങ്ങനത്തെ സ്ഥലങ്ങളിൽ നിന്ന് ഹിയറിംഗ് എയ്ഡ് വാങ്ങിക്കാണ്ടിരിക്കുക. നിങ്ങൾ അടുത്ത് തന്നെയുള്ള സ്പെഷ്യലിസ്റ്റിനെ കാണാം. സ്ഥലം എവിടെ പറഞ്ഞത്?
ഞങ്ങൾ കേരളത്തിൽ എറണാകുളത്ത് നിന്ന് വിളിക്കുന്നത്.
എറണാകുളം ഒരുപാട് ഓഡിയോളജി സെൻറ്റേഴ്സ് ഉണ്ട്, സ്ഥാപനങ്ങളുണ്ട്. അപ്പോൾ നിങ്ങൾ എവിടെയെങ്കിലും ഒന്ന് കൺസൾട്ട് ചെയ്ത് അവിടുന്ന് വേണ്ട കെയർ എടുക്കുക, അതായിരിക്കും നല്ലത്.
ഓക്കെ സർ, താങ്ക് യു സർ.
ഓക്കെ, താങ്ക് യു.
Okay, thank you. Okay, so industry, if you're working in the industry is a noisy environment, you're supposed to use the hearing protection devices. So that limits the occurring of hearing loss.
That limits the amount of hearing loss that can happen. And these are much required when the noise levels are higher. Otherwise it is not required. See, for example, it's a quiet situation, you don't have to go for it. Okay, but when the noise levels are too high, the easiest thing is what I told some time back. You talk to somebody, you find it difficult to hear. That indicates that the noise levels are very high there. So that time, you have to consider going for these kinds of ear protective devices and use it as long as you're working in noise. For example, there is a machine that is producing too high noise. So when you go and work there, you have to ensure that you're wearing that ear protective device. That is the only way to safeguard the ear. Otherwise, you will start developing hearing loss not in 1 or 2 years, it can go up to 5 or 10 years also. Okay. So it's a long-standing process. So every day, some amounts of cell will keep damaging and hearing loss can arise.
Okay. So as I said, the phone, your mobile phone music listeners, it is more avoidable one. And here it's a profession, so obviously we cannot avoid it. So it's better that listen to music in a minimal sound and give a time period for when you're listening for a music through earphones. And if you are working in a noisy environment, make sure that you use the hearing protection devices. Okay, so Dr. Devi, so as he said, the noise is going to affect the hearing and its music is going to affect it. What are the indicators? How do we know that it is actually affecting our ear?
Many a times actually it's invisible, we can tell. Initial stage you can't make out that actually your hearing is getting affected, but as slowly the symptoms that can, or the signs that can be seen are like you might get a tinnitus kind of sound, like the ringing sound that can be heard in the ear, or you might feel that there is something blocking in the ear. Okay, or some sounds you might be able to understand and some sounds you will not be able to understand. Okay, like half of the words you will be able to clearly hear it, and half of the words you will not be able to clearly hear it. And especially this problem will be more in terms of understanding when there is some other noise that is around you, or if there are 2 or 3 people they are speaking around you, you may not be able to understand what they are speaking clearly. Okay, these are the simple signs that you might initially face, which indicates that you are getting into the line of trouble of having any ear related problems. Okay, because of either listening to earphones or headphones, or listening or working in a noisy area. So before even you get into these signs, our advice is that get your hearing tested. If you already know that you are wearing earphones frequently, or headphones, or you're working in a noisy place, get your hearing tested frequently. Once in every 6 months, make sure that you undergo a routine audiological evaluation to monitor yourself whether your hearing is within the limit. Okay, so this will help you to understand yourself whether you are getting into the trouble of any hearing problems.
Okay, so the tinnitus is going to be an indication that the person might have an hearing problem or something like that. So that means the ear says to us that you have a problem or something like that. Yeah. So the sixth tip is going to be so don't neglect when you come across any of these signs and symptoms. It may be of an hearing loss, or it may be of a blocking sensation, or it can be of a tinnitus. So please don't neglect it. Immediately consult a doctor and undergo a testing. Okay. So in this context, most of the questions when I asked to both of the doctors, you keep saying it, consult a doctor, right? So that's the right step that you have to go for hearing care. But how fast you have to consult it?
That depends on the kind of problem. For example, we discussed about wax. I told there is no need to worry about it. Ignore it. Okay. We'll take the call.
Hello. Hello. AIISH phone in program.
Hello, sir. ನಾನು
சொல்லுங்கள்.
எங்களோட பாப்பாக்கு வந்து காதுல மிஷின் போட்டு விட்டோம் 1 வருஷத்துக்கு முன்னாடி, காது கேட்கலன்னு.
ஓகே.
ஆனா அப்ப வந்து அவருக்கு என்ன ஆகுதுன்னா காதுல வந்து ஃபுல்லா அழுக்கா படிஞ்சிருது. அது வந்து எப்படி மெயின்டைன் பண்றது, எப்படி பாத்துக்கிறதுன்னு தெரியலைங்க சார். அது என்ன பண்ணலாம் அதுக்கு?
ஓகே, ஒரு நிமிஷமா டாக்டர் தேவி அங்கே சொல்லுவாங்க.
இதுக்கு முன்னாடி நாங்கள் டிஸ்கஸ் பண்ண மாதிரி காதில் வந்து கொஞ்சம் அமௌண்ட் ஆஃப் அழுக்கு அது வந்து எடுத்தாலும் வந்துக்கிட்டே தான் இருக்கும். ஆனால் இவருக்கு வந்து ஏன் அங்கே அழுக்கு சேர்ந்துட்டு இருக்குன்னா, அவர் மிஷின் ஆல்ரெடி போடுறப்ப இயர் மோல்டும் சேர்த்து போடுவாங்க. ஸோ அவங்களுக்கு வந்து அந்த காது அழுக்கு வந்து வெளியில் தானாகவே வெளியில் வந்து விழுறதுக்கான வாய்ப்பு வந்து இல்லாமல் இருக்குது. ஓகே, அதனால் அந்த காது அழுக்கெல்லாம் வந்து அவர் காது உள்ளேயே சேர்ந்துக்கும். ஓகே, பின்ன அவருக்கு இன்னொரு ப்ராப்ளம் என்னென்னா, ஆல்ரெடி தாத்தான்றப்ப அவருக்கு ஏஜ் ஆகிருக்கும். ஓகே, ஏஜ் ஆக ஆக நம்மளோட அந்த காது இந்த ஓட்டை இருக்கு இல்லையா, ஸோ அதுவும் வந்து கொஞ்சம் ஷ்ரிங்க் ஆகும். ஓகே, அதோட சைஸும் வந்து கம்மியாகிறப்ப வெளியில் வந்து அந்த அழுக்குங்க வந்து வெளியில் வந்து விழுறதுக்கான வாய்ப்புகள் வந்து ரொம்ப கம்மியாயிடும். இப்படி இருக்க சுச்சுவேஷனில் வந்து நீங்கள் வந்து டாக்டர் கிட்ட கூட்டிகிட்டு போயிட்டு நம்மளே வந்து ஒன்ஸ் இன் 6 months மேனுவலாக அவங்க டாக்டர் வந்து க்ளீன் பண்ணி கொடுக்கணும். அது மட்டும் இல்லாமல் அவங்க காதுலேருந்து அழுக்க மட்டும் எடுக்காமல் ஹியரிங் எய்ட்லேயும் வந்து அந்த இயர் மோல்டுலேயும் வந்து அழுக்குங்க வந்து போய் சேர்ந்துக்கும். அப்போ அவருக்கு நீங்கள் மிஷின் வச்சாலும் அவரால் வந்து அந்த சவுண்டுங்க வந்து கேட்க முடியாது. ஏன்னா வந்து அந்த அழுக்குங்க வந்து பிளாக் ஆயிருக்கனால. ஸோ அந்த இயர் மோல்டையும் க்ளீன் பண்ணணும், இல்லை இயர் டிப் வச்சுருந்தாங்கன்னா அதையும் க்ளீன் பண்ணணும். அது மட்டும் இல்லாமல் நீங்கள் ENT டாக்டர்கிட்ட கூட்டிகிட்டு போய் காதில் இருக்க அழுக்கையும் வந்து டாக்டர் மூலமாக எடுக்க வைக்கணும். ஏன்னா அவங்களுக்கு வெளியில் தானாக விழுறதுக்கான வாய்ப்புகள் வந்து கம்மியாயிடுச்சு. சரியா, ஒரு தடவை க்ளீன் பண்ணிவிட்டு அப்புறம் ஒவ்வொரு 6 மாதத்துக்கு ஒரு தடவையும் நீங்கள் க்ளீன் பண்ணிக்கிட்டிங்கன்னா இந்த மாதிரியான ப்ராப்ளம்ஸ் வந்து வராது. அவருக்கு சவுண்டும் வந்து நல்லா கிளியராக மிஷின்லேருந்து கேட்கும்.
சரி மேடம், ரொம்ப நன்றி மேடம்.
ஓகே, நன்றி.
தேங்க்யூ.
Yeah,
So we
we're
were
talking
talking
about how
about
fast we
how
are
fast.
going.
So if it's a child, I told you, wax, you don't have to worry much. But if it's a child's matter, when the child is like, born and, you suspect that hearing loss is there in some time, you didn't do the screening at the early stage, but child is not responding to the, you call the name, child is not turning the head. Okay, when you use noise makers, child is not turning the head. Such situations and all, you should not, delay at all. Immediately care should be taken. Okay, you have to consult a specialist so that they are able to assess the hearing of the child and give proper amplification device. It can be a recommendation for cochlear implantation, it can be a recommendation for hearing aid, it can be a recommendation for devices called as BAHA, or some kind of device, or some rehabilitative program the child should be enrolled in immediately. So such cases you cannot ignore. And then another case is sudden sensorineural hearing loss, wherein today you are hearing properly, morning you get up, you one side or both the sides are not hearing. So in such a situation also the care need to be taken immediately. You should not lose time. Immediately consult an ENT surgeon or an audiologist, get your hearing evaluated, and then ensure that some amount of progress is there and you're improving. So it purely depends on the kind of problem, but anything related to ear, you have sudden severe ringing in the ear or tinnitus sound what is being heard. Okay, consult, because it can be an indication of something which is hidden. So you have to identify what is it, and then you can be at peace. So that's the basic thing. So I would advise to consult at the earliest if you indicate or if you feel that some kinds of problems are there.
So really it is always the better. So we have to
Yes,
consult
earlier the
immediately then, so that we can rectify it at the earliest. Okay. So till now we have seen about the newborns and children as well as adults. So is there any tip for the elderly citizens? 1 minute, we'll have a call. Hello. Hello, AIISH phone in program. Hello.
Hello, is this a Facebook Live program?
Yes, it's a Facebook Live program. Tell me.
So actually, we have a few kids in our family. So the youngest one is, I think, 2 years. Do I need to get a test done for all of them, like all my children in the house and stuff like that?
Yeah, 1 second. Dr. Shiraj will answer for you.
Do you suspect some amount of hearing loss, or do you think the child is not responding to sounds, name call when called from the next room, or when.
Sir, one of these boys is 5 years old now.
Okay.
He's fine that way, like everything is okay. But when you talk about screening and newborns getting tested, and so my kids have not really gone through any of that.
Okay.
So just
Like now, since the child is 2 years of age, the child is like properly speaking to you, right?
the younger one is 2 months old only.
2 months
now,
old.
so-
Okay. So like the easiest thing to do is like at home, you can take a small box, and inside you can put some pepper or salt or something like that to make a noise maker. Okay, this is a good way of doing it, but still, and then slightly keep it away from the child and try to make some noise. You see if the child is responding, and if you don't find a response, I would advise, since the first child is normal, there were no complications in pregnancy and all that. That's why I'm telling you this advice, otherwise I would not do that. So just try to check at home if the child is all right. If you suspect that the child is not hearing, consult an audiologist. There are ways in which the hearing can be tested immediately after birth also. As I told in the newborn screening, we can do an evaluation. So its first thing is like what do you feel about it, whether hearing loss is there or not. And don't delay if you suspect that just because I told screening need to be done on every child, don't panic. It's not that everybody will have hearing loss. And if you have family history, if you have first sibling having some amount of issue, if the baby is not at all responding to sound, such things if you feel, then you can go and consult.
Okay. So in my house, actually, nobody has a hearing problem. I think it's just my grandfather who has a problem in the recent years. That's all. So there's none of those factors that you said. So
Okay.
I can just check at home with that.
Yeah, you can check at home, and then if you feel there is some amount of problem, then you can probably consult an audiologist. But I think the child should be all right, but just have a watch on the child and ensure the child is responding to sound. That is the only thing what you can do. Make some noise and then ensure child is responding. If you call call the child, and then the child is at least opening the eyes or slightly moving, that gives an indication that the baby is hearing well. So if those things are not there, then you can go for consultation.
Okay. Thank you.
Yeah, you're welcome.
Okay, thank you so much. So we are running short of time, so briefly just tell about the elderly citizens. What is the care for this one?
See, when you say elderly citizen, we are talking about the age factor.
Age.
So, as and when they age becomes, then it's better that they go in for a regular monitoring of their audio hearing related aspect also. So please get your hearing checked once in 6 months or once in a year. Okay. The other tip is, if you think that you are listening to music or you are in a noisy area, make sure again you get your evaluations, hearing evaluations regularly. Okay. And take medications only if it is prescribed by the doctor. Don't go in for any self medications. So these are some of the tips where you can care for your ears in an elderly population.
Okay, so you have to rightly be pointed out that they have to undergo testing and then fitted with the hearing aids if they
And
are
also
having
to
a hearing
use
loss.
ear protective devices if at all they are working in any noisy place.
Okay. So anyway, as you said, as a whole, as a concluding remark, that you have been telling that wherever they're working in a noisy environment, they are supposed to use hearing protection devices, and they have a hearing loss, they are supposed to go for fitting up hearing aids. They really require to it, right? So that's a good suggestion also. So what about Sriraj? So what we are not supposed to do it?
Supposed to do in terms of okay, the first thing, try avoiding loud music. Okay, there was some debate about what volume level to keep. So I would advise never keep it beyond 70% of the total volume control. So that's one value if you want. Never keep it above 70% of the total volume levels of what is available in the device. And then don't clean your ear by yourself. Okay. And if there are any kind of symptoms, ear pain, ear discharge, tinnitus, vomiting, giddiness associated, go and consult the doctor immediately. Okay, and do not ignore sudden hearing loss. If at all, I told you sometime back, if you have loss suddenly, immediately go and meet a doctor, because that requires immediate care. Otherwise, permanent loss will be there and it is not going to reverse. So these are the tips I wanted to give.
Okay, that's the valuable suggestions to the public. So with that, we are coming to the end of the phone live in program. So that's the extraordinary information which we have come out on the hearing care as well as the safe listening part of it. So we got to know the useful tips on hearing and how to take care of the ear, right? So, but remember that the alarming fact is that the hearing loss is one of the most common birth defects. So, out of 1,000 babies born, 3 to 4 babies are born with significant hearing impairment. And because they are born with that, they are not able to hear, and because of that, they are not able to speak as well as a communication. But the most interesting fact is that nearly 60% of the hearing loss are due to avoidable causes. That means it is preventable. It's all in our hands. So we can able to prevent the hearing loss if we follow all these small hearing care tips. Okay. So use your ear appropriately, get your hearing tested and save hearing. So with this, I urge all the viewers to support us and promote hearing care and safe listening to achieve the goal of this year's World Hearing Day 2022 and also spread the word to your beloved ones. So visit our website www.aishmysuru.in for any further clarifications. Follow us, stay tuned for a lot more to come up. Thank you all.